Hi, this is Dr. Rachael Coleman, and today we're going to continue on our series talking about cardiovascular health, but specifically vascular health. This is the second part of our series for Bless Your Heart. Today we'll hear the accounts of two women who found themselves in the throes of a medical crisis and how they went from not just surviving the events, but to thriving. Today we're here with Mary Woods, also known as Mother Woods, and she recently had a bit of a health scare. She's going to share her journey with us, but prior to that, can you tell us a little bit about yourself? I know for many years you have beautified Greater Cincinnati. Can you just tell us a little bit of, you know?
I've been a beautician for over 50 years.
Wow.
And I was like semi-retired, but now I am fully retired.
Okay.
And I had been here all day, no problem. But I noticed when I would be on the phone, the receiver kept dropping out of my hand. I thought nothing about it. I would keep talking. But when it come time for me to go upstairs to go to bed, no problem. I got up, walked to the hall.
And that's because your shop was connected to your home.
Right.
Okay, next door, adjacent.
Yeah.
So
I
you
would
have
have to
far to
go
go.
outside to go into the other door to get to the shop
Okay,
for the last 20 years.
okay.
And all I had to do that time was just go into the hallway and walk up the steps to go to my bedroom. Well, I got to the step, and I don't remember for sure if I went 2 steps or 3 steps, but my left knee went out on me. And I'm used to that, and I'm gonna make it go anyway, so I just reach over to catch the balusters on the wall, because I'd had a knee replacement and had a baluster put on the right side. Okay. So I was able to walk up the stairs with ease. So I reached over to get the baluster, and I couldn't catch nothing. And when I knew anything, I was going backwards, falling. I fell backwards down to the floor. All I knew to do was call Jesus because I couldn't catch nothing. I did not lose conscience. I did not break anything. I fell backwards on the floor, and I knew I couldn't get up because I've had problems with my back, and if I fall, I have to slide against the wall to get up. This time, I turned around and slid back against the door facing. I still couldn't get up. I used to have my cell phone on me or in a bag on my arm. Well, it jumped out of my bag, and I'd reach over and got my cell phone and dialed my daughter, no problem. And she have keys to the house, so she came right on over. She and her husband. They wanted to call 911. I said, I'm okay. So she said, okay, Mom. I said, just help me get up the steps. So I sat on the step with their help, and we got up the steps. And I have another set of steps up there, and I was able to turn around and catch the balusters and walk into the bathroom. And my son-in-law brought my walker. I was using a walker occasionally, but not all the time because of my back. And he brought my walker, so I walked into my room and sat on the side of the bed. And they saw that I got in the bed, and then they left. Well, I have a 2 o'clock run to the bathroom. I did that fast. I got out of bed, went to the bathroom.
You were able to walk to the bathroom?
Yeah, I was able to walk. And then I went back to bed. I had my 4 o'clock run to the bathroom.
Okay.
That time, I got out. My leg was hurting so bad. And I knew I wasn't going to be able to make it to the bathroom. So I reached over to get the trash can. I couldn't get the trash can. My leg went all the way out. And I slid down to the floor and fell again.
So your left leg wasn't working?
Both times.
Okay.
It was
and it was actually hurting?
It was actually hurting.
Okay.
It hurt so bad that I couldn't stand up.
And when you reached for the garbage can?
With my right hand.
Okay.
My hands was okay.
Okay.
But I couldn't get it and I couldn't stand up. So I had to just let it go. Okay. And I was on the floor. So I couldn't get up. I sat there. So my phone is on the nightstand. I was able to reach over and dial my daughter again.
Okay.
And I said, she said, Mama, you done had a stroke. I'm going to call now. I said, don't call them people to come in here screaming to wake my neighbors up. I said, but call your brother. He'll be getting off in a little bit, and he can come and take me to the hospital. Well, she called 911 anyway.
She did the right thing. So
she got here ahead of them and came upstairs. And by that time, they was here. 4 big old men up my steps in my room. They put this blanket on my bed and picked me up and put me on it. Okay. And they carried me down the steps and out to the gurney and put me in the ambulance. Yeah. And they did not have the sirens going like they was asked. But as soon as they got down the hill to the street, they started blasting.
So they didn't put the sirens on because of your request?
Right.
Okay.
But they came on with the lights flashing.
So people would get out their way?
Yeah, the lights was flashing
because
I could see them. And they got down the foot of the hill, they started blasting the siren. And they was asking me questions all the time if I knew my name, if I knew my address. And they was talking to me the whole time. I never lost conscious.
That's good.
And got me to the hospital. They wanted to know, do you know where you are? I said, sure, I'm in emergency. What hospital? I'm at the Christ Hospital. Okay. And they took me in there, and then a whole lot of stuff went on then. Okay. But anyway.
So at some point, did they tell you that you had a stroke?
No, they didn't tell me till a day later.
Okay.
And they did all kind of tests. They put me in that barrel that they put you in to do testing. They took that and brought me back. They did 2 of them and brought me back. And I was still conscious of all of this. I never lost consciousness.
No, what did you think was going on?
I didn't know. Okay. I was never told how you feel when you have a stroke or what happens. So I didn't know. All I know is I have fell again and couldn't get up. Because I have fallen before and couldn't get up. But I was always someplace where I could scoot backwards and slide up and sit. It's for the grace of God. The whole increment from the beginning until now. And for me to be able to go outside in my hall and walk up them steps and fall backwards and my head hit the door. Don't lose conscious. It's the grace of God.
You're right, because you could easily have had
I
a
could have broke my
concussion.
back.
You could have broke your neck, and you could have
I
had.
could have broke my neck. I could have bust my head open.
That's right.
It was for the grace of God that lets me know I still got work to do.
That's right.
Because I know people had less than that happen to them, and they gone on to glory.
Right. That's right. So, what is a stroke? We use the term stroke to basically describe any interruption to blood flow in the brain specifically. This interruption can be from an occlusion, a blockage, what we call an ischemic stroke, or it can be from the blood vessel leaking or rupturing, what we call an hemorrhagic stroke. Strokes can also be transient, what we call a TIA, or a transient ischemic attack. But it is very important to recognize the signs and symptoms quickly. So how can you tell if someone is having a stroke? Remember the acronym FAST, F-A-S-T. F is for face. Is there any facial weakness or drooping or any numbness in the face? Can the person smile? A is for arm. Is there any weakness or numbness in the arm or the leg? Can they move each side equally? S is for speech. Is there any loss of speech or difficulty speaking or slurring of the words? And T is for time, because time is of the essence. If any of those symptoms exist, call 911, because this is a medical emergency and you have to get care fast. Note what time the symptoms first began so you can tell medical professionals, and again, get that help fast. There's a window of time that certain medications can be provided that can improve the outcomes. So don't just go to bed, think that you just need to lay down, but get help fast. So what are some more complications from stroke? Well, according to the Mayo Clinic, there can be loss of muscle movement, what we call paralysis. There can be trouble talking or swallowing, memory loss or trouble thinking. Emotional symptoms can occur from difficulty controlling one's emotions to depression. There may be pain or numbness in the affected area. There may be trouble seeing, or problem seeing in one or both eyes, or even seeing double. And there could also be sudden severe headache that may be associated with dizziness or vomiting. What are some risks? Well, there are lifestyle risks. The lifestyle risks can include being overweight or obese, physical inactivity, heavy or binge drinking, or using illicit drugs such as cocaine and methamphetamines. According to the Mayo Clinic, medical risks include high blood pressure, tobacco use like cigarette smoking, and also secondhand smoke exposure, diabetes, high cholesterol, obstructive sleep apnea, heart diseases from heart failure to heart defects to myocardial infarction, what we call heart attack, and irregular heart rhythms like atrial fibrillation, having a personal history of stroke or heart attack, family history of stroke or heart attack, being of the African American or Hispanic race and ethnicities in comparison to other races and ethnicities, being above the age of 55. Males tend to be more affected than females, but females tend to be older but tend to die from having a stroke. And the other risk can include hormone use, from contraception to estrogen replacement therapies. So how do we prevent strokes from happening? We want to control blood pressure, decrease intake of cholesterol and saturated fats, quit tobacco use, manage diabetes, maintain a healthy weight, get some exercise in regularly, eat fresh fruits and veggies, treat obstructive sleep apnea, and avoid illicit drug usage, but take your prescribed medications. There can be medications prescribed that will help to prevent having future strokes. Hi, this is Dr. Rachael Coleman with BN Health, and today we will hear the incredible, miraculous story of Rosalind Yancey. A few months ago, I actually ran into her at a local mall, and I was very impressed by her because she was there walking. She had a nice pace going, and I could tell that she didn't have time to talk. And as I moved on to my destination, I reflected on her incredible health journey. At the time, several years ago, we went to the same church, and I could remember a call being made out to pray for her. There were dire circumstances, and thankfully, she's here to share them today. Well, welcome, Mr. and Mrs. Yancey, to Be in Health.
Thank you.
Thank you.
Before we talk about that health emergency in 2011, take me back to 1996.
1996, I started having headaches, frequent headaches, and they was pretty painful. And so when I went to the doctor to get them checked out, I was told that they were sinus headaches.
Okay.
And to start taking Sudafed because I was going to have them till I die. So I started taking the Sudafed in 1996, and I was taking Sudafed still in 2011.
So let me kind of go back a little bit. My understanding is you had actually gone to urgent care, and the urgent care provider had basically diagnosed you with the sinus headaches and recommended the Sudafed.
Right. I went to see the doctor at urgent care because they were pretty painful. And the doctor told me that are you just having sinus headaches? Get you some Sudafed. You're going to have them till you die.
Okay.
And
did the Sudafed help?
Not really. Nothing really. It eased the pain some, but it never stopped the pain.
Okay.
The pain was, it was there all the time.
Okay.
Whenever it came, it was there all the time.
Would you say on an average week, more days out of the week than not, or?
Yeah, more days out of the week than not, I would have them. And during the warmer seasons, it was really bad.
Wow. Okay.
It was really bad.
So, moving forward to 2011, which is 15 years later, tell me about that evening in March. What was going on?
We were finishing up a teaching class, and that night I was the first speaker.
You were at church.
Yeah, we were at church that night. That evening we were at church, and we were finishing up a teaching class. I'm up speaking, and I start to feel myself getting lightheaded.
Okay.
Getting a little dizzy and everything. And the longer I stood, the more I seemed to lose my balance and everything. And so actually that's what ended up happening. I went out, not completely, but I could feel myself getting ready to hit, to fall on the floor. And so the paramedics were called.
So someone noticed that something wasn't quite right. And they made the decision to have somebody call.
Yeah.
And then the paramedics came.
Right.
And then and they asked if you wanted to go to the hospital.
Yeah, they asked me if I wanted to be taken to the hospital, and I told them no. I said, I think I just need to go home and go to bed. And, and at that point, I was told, he said to the people, we can't take her because she's denied in the service. And so they called my husband, called my family, and a few minutes later, my husband showed up, and, I had to be put in a wheelchair because I didn't, I wasn't stable, able to, enough to stand alone and everything. So I was put in a wheelchair, taken to the truck, and, after that, I was out.
So you lost consciousness, on the way to the hospital? Okay.
Yeah, I was out. So, by the time we made it to the hospital, I had no clue of what was going on.
And from what you shared with me earlier, someone had called your kids, and one of your kids, who was a doctor, had said to keep her awake. Can you share a little bit about that, Mr. Yancey?
Yes, my daughter Candace, live in Dallas. We had her on the telephone, and she said, "Don't just try to keep her awake." She kept trying to fall asleep, and we kept her awake till she seemed to be awake, but she probably didn't know she was awake.
Right.
But she was awake until we got her to the hospital, and then that's when I took her to the closest hospital. So once they got her there, they got her stable, and then they were going to airlift her, but the weather was bad tonight, so they had to take the ambulance to Christ after they got her stable.
Okay. And how long, Mr. Yancey, have you all been together?
Since 1979,
Okay.
4 years.
All right. So what was going through your head, and when did this get real for you?
When they asked me to sign the papers, that was kind of hard to do.
Okay,
I know it's getting real serious now.
Okay. And usually, there's consent forms to sign,
Right,
and
yes.
they go through the good, the bad, and the ugly that
Right.
can happen. And
Right.
I know that had to kind of hit home a little bit there.
Right.
So you had lost consciousness, and the last thing you remember was being in the vehicle or getting in the vehicle.
Right.
What
Yes.
was the next thing you remember?
The next thing I remember, we're talking 2 weeks later. Because in between,
Because you were unconscious
Yeah.
for 2 weeks.
yeah, I mean, I had been taken to Fairfield Hospital. They did whatever it was they did. Then you see,
Yeah. It went to
when the surgery took place.
you see,
Yeah.
yeah,
So
right.
when I left Fairfield, they took me to UC, and that's where when the surgeon got there, he made the decision to do the brain surgery.
Yeah, and it's important that, of course, that you were stabilized at the outlying hospital, and it's also very important that you were transferred to a bigger medical facility.
Right.
Most people don't know that UC is actually on the map for
Right.
brain attacks, if you will.
Right.
Yeah, right.
And
right.
you were ultimately diagnosed with an aneurysm.
Yeah, I was diagnosed with aneurysm.
But
yeah.
prior to that, someone, I guess one of the medical staff, maybe wasn't too optimistic about what was going to transpire. And sometimes, they try to prepare the family for the worst.
Right.
What was said to your children, and how did they respond? How did your children respond?
Well, I was told by my son that he had been told by one of the nurses that they might want to prepare because chances are I wasn't going to make it. And so he was really upset about it. And, some other family members found out of what the lady had said to him. And she spoke to the nurse, our daughter, she spoke to the nurse, and she asked her not to say that to him again. She said, because my mom is not going to die. She said, so please don't speak. We don't want to hear anything concerning death because we don't believe she's going to die. And, and as far as I know, nothing else, happened in a negative way concerning that. But that's what the nurse had spoke to them, and so.
And of course,
Because it was
the
a
church
bad
was also
situation.
praying.
Oh,
The church
absolutely.
was not ready to let
Absolutely.
you go either.
Right. Thank the Lord for that, But yeah, the church was praying for me. The church was there. Some of the people were coming out every day.
That's
You
good.
you know, and my church was very supportive. Very
Excellent.
supportive to myself and my family.
I can remember them saying to pray specifically for your blood pressure. Again, not really knowing what was going on, all the details of your diagnosis and everything. So that was one thing that was being done, was the concern about blood pressure. So when did that, from what you can remember, what you were told, became apparent that your blood pressure was very high?
Now he could probably speak
Well,
better.
Well, the same night that they had the paper. I couldn't find it, but yeah, it was really high. I can't exactly remember the number, but it was death numbers. It was way up there.
Okay. But prior to this, you had not been diagnosed with high blood pressure. Is that correct?
No, not that I can remember. I hadn't. I'd never had any type issues like that.
Okay.
No, that had never. No, I only started when I started having the headaches. That's when, and like I said, it never really, the pain never stopped. It never completely stopped. It was just enough where I could function. But after getting into the hospital, the surgeon spoke to my family and myself, and he told us that they were, that she was never having sinus headaches. It was the aneurysms.
So after you had the aneurysms repaired and removed, did you ever have that type of headache again?
Never.
Never.
I've never to this day had one of those headaches.
Awesome.
And I had 2 brain surgeries.
And you had a total of how many aneurysms did they find?
There were 4 aneurysms. He found 4 aneurysms.
Wow.
Yeah.
And it was on both sides of your brain, is that correct?
Yes.
So that was something to find all of that, because there was not only one threat, there were potentially 3 others that were taken care of, which is very important.
Right.
So now on this side of things, usually after a brain aneurysm, which can cause a stroke is, when there's a disruption of blood flow and that tissue on the other side can die. Some people have neurologic deficits or have some trouble, some type of functional, impairment. Have you noticed any impairments related to difficulty walking, talking, so forth, swallowing?
I've never had any difficulty with my speaking, walking, anything. Never.
And you shared with me earlier that you had one physical therapy session, and in fact, your son told you to slow down. Is that correct?
Yeah, the rehabilitation team, after I had gone home, they were set up to come, to visit me at least twice a week. And the first visit, I believe, was on a Wednesday when the team came out, and they walked me up the street, and everything. And my son was like, "Ma, slow down. Wait on the nurse. You're leaving her behind. You're leaving her behind." And so I said, "Okay, awesome. Okay." So when we got back home, she looked at me and she said, "I'm not coming back over here. There's nothing wrong with you."
Well, I'm glad that, for one, you are here to share your story.
Thank you very much.
And I'm glad that you have taken the reins on your health and doing what you can to live long and strong.
Yeah, thank you so very much.
Thanks for sharing your story.
Thank you.
I'd like to thank our guests for taking time out of their busy schedules to share their stories. Hopefully you've learned something new, gained some insights, and remember to treat a stroke fast, F-A-S-T. F is for face. If there's any facial asymmetry, any facial numbness or weakness, person can't smile. A is for arm or leg, any weakness in the arm or leg, can't move the arm or leg. S is for speech, difficulty talking or slurring one's words. And T is for time, because time is of the essence. Every minute counts. Call 911 immediately and get the help that you need so that life-saving treatments can be rendered. Until next time, treat a stroke fast, bless your heart, and be in health.